On behalf of the MD Run Collaborative, my name is Irina Yudin, and we are on our final module, number 8. In this tutorial, we will be discussing both the skin and bone marrow biopsy procedures. Just like the previous tutorials, we will give a quick definition of the procedure and discuss in more detail the indications for these procedures, safety considerations, intra- and post-procedure care and monitoring, as well as complications that can result from these interventions. Let's review skin biopsies first. A skin biopsy uses one of the several techniques to remove a skin lesion primarily for diagnostic purposes. There are 4 main types of skin biopsies: shave biopsy, punch biopsy, excisional biopsy, and incisional biopsy. The choice of the different skin biopsy is dependent on a suspected diagnosis of the skin lesion. A shave biopsy is done with either a small scalpel blade or curved razor blade. Ideally, the razor will shave only a small fragment of protruding tumor, leaving the skin relatively flat after the procedure. A punch biopsy. With a punch biopsy, it is done with a circular blade, which is rotated down through the epidermis and dermis, and into the subcutaneous fat, producing a cylindrical core of tissue. It is used most often to diagnose inflammatory skin conditions. An excisional biopsy is essentially the same as the incisional biopsy, except the entire lesion or tumor is included. This is an ideal method of diagnosis for small melanomas. The indication for performing a skin biopsy include to confirm a clinical diagnosis, to diagnose and simultaneously provide treatment, such as example of excision of basal cell carcinoma, to establish response to treatment. Another example is mucosis fungo, to remove a neoplasm and check its margins to ensure complete excision. There are a few absolute contraindications to skin biopsy. It should not be performed at the infected site, although occasional infected site is an indication for the procedure. Patients should be asked about allergies to topical antibiotics, antiseptics, local anesthetics, and reactions to tape. The skin biopsies are done usually by the consults rather than the ICU team. They often bring their own insertion kits and tools specific for the type of biopsy technique they're performing, along with specimen containers. However, we should be prepared with a procedure cart in hand for additional supplies and offer lidocaine from the Pyxis to support this procedure. Before going any further, remember your standards of procedural safety and complete your pre-procedure care. Consider past medical history and what may place your patient at increased risk, specifically skin disorders, skin grafts, immunocompromised disease states. Do they have a coagulopathy or at risk for bleeding? Any allergies? Be sure to check in with your patient or family to explain the procedure and see if they have any further questions. Check to make sure that the proceduralist is credentialed to perform the interventions. Finally, be sure the consent is signed and initiate and document the timeout for the procedure. Once again, let's review the intra-procedural care guidelines to support sterility and safety. Start by making sure you have everything you need for the procedure in the room and the procedure cart is close at hand. Double check with the consulting procedures to be sure they have what they need before the procedure gets underway. Clarify any needs for local pain med or sedation. Wash hands for at least 15 seconds. Put on a cap, mask, and gloves. Maintain sterile procedure with all assist. If you're holding the patient to assist, be sure to avoid getting near the sterile drapes. Reevaluate your ability to support the patient's position and assess the procedure. Get additional help from the care partner or intern to make sure the patient is well supported to maximize a successful procedure. Also, do a quick assessment on the patient's vital signs while positioned for the procedure and then evaluate their ability to tolerate the position for the duration of the procedure. Communicate any concerns or suggestions to the proceduralists before getting started. Offer reassurance to the patient throughout the procedure. Keep an eye on the patient's vital signs and comfort level during the procedure. Communicate any changes from baseline during the procedure. Immediate post-procedure care will focus on ensuring hemostasis at the biopsy site. Apply a sterile occlusive dressing, offer reassurance, and evaluate needs for pain relief. An ongoing monitoring includes observing vital signs and symptoms of bleeding, infections, and pain at the site. Skin biopsy are generally well tolerated. Complications that can occur include hemorrhage, local or systemic infection, delayed healing, severe scarring. Bone marrow biopsy and bone marrow aspirations are bedside procedures performed to diagnose and classify various hematopoietic diseases such as leukemia, multiple myeloma, lymphoma, anemia, and pancytopenia. The bone marrow procedures are cellular elements of the blood including platelets, red blood cells, and white blood cells. Although a lot of information can be obtained by testing blood serum, bone marrow biopsy allows for examination of the source of the blood cells in the bone marrow to get more information on hematopoiesis. Results from these procedures can support clinical treatment and reassessment and assessment of engraftment after bone marrow or stem cell transplantation. So let's review the specific indications for this procedure. First, to diagnose and monitor hematologic abnormalities. Second, to diagnose bone marrow involvement before stem cell collection and for staging of various malignant states. Third, to assess the status of the disease after stem cell transplant. Fourth, to assess status and immunologic reconstitution following stem cell transplant. And finally, to evaluate immunodeficiency syndromes or to confirm an infectious disease process in the marrow. Contraindications for bone marrow biopsy and aspirations primarily related to blood dyscrasias, such as hemophilia, severe DIC, and other bleeding disorders that could lead to serious bleeding after the procedure. The bone marrow biopsies are also done by consults rather than the ICU team. They bring their own insertion kits and tools specific for the biopsy along with the specimen containers. However, we should be prepared with the procedure cart on hand for additional supplies and offer lidocaine from the Pyxis to support the procedure. Let's review our standards of procedural safety and complete your pre-procedure care one last time. Consider past medical history and what may place your patient at increased risk, particularly immunocompromised conditions or bleeding disorders. It is common that the patients undergoing a bone marrow biopsy have a diagnosed cancer or have undergone therapy that has left them with a coagulopathy and would require transfusions with platelets and possibly FFP prior to the procedures. Review their latest counts with the proceduralist before getting started. Consider allergies. Be sure to check in with your patient or family to explain the procedure and see if they have any further questions. Check to make sure the proceduralist is credentialed to perform the intervention. Check new innovations. And finally, be sure the consent is signed and initiate and document timeout before the procedure gets underway. In addition to your standard pre-procedure safety considerations, patient preparation and teaching, you will want to also assess for pain and anxiety and manage these issues ahead of time so your patient's comfort can be optimized. Local lidocaine will be used. Consider conscious sedation for non-intubated patients. Fentanyl is routinely used for its short-acting analgesic effects, and Versed for its sedative, anxiolytic, and amnesiac properties. Address any concerns you may have with the proceduralist and ICU team. Whenever using conscious sedation, you should be familiar with the reversal agents. Narcan is used as the effects of narcotic analgesic like fentanyl, and flumazenil can be used to reverse Versed. Post-procedure interventions will focus on establishing hemostasis at the biopsy site. Apply pressure dressing and hold pressure for a minimum of 5 minutes. Provide pain relief when necessary. Use cold compresses if desired and monitor carefully to safely recover your patients from conscious sedation. An ongoing monitor includes observing vital signs and symptoms of bleeding, infection, and pain at the site. Bone marrow biopsies are generally well tolerated. Complications of bone marrow biopsies include excessive pain, hematoma formations, inability to obtain a specimen, retroperitoneal bleeding, and local infections. Well, that concludes not only the skin and bone marrow biopsies, but all of the tutorials for the procedural safety. I hope that the information provided during this education will influence the care that you deliver to your patients when undergoing invasive bedside procedures. Our knowledge, together with a commitment to safety and care, can have a profound impact on patient outcomes during these times of increased risk. Thank you for listening and providing the very best care to your patients and families. Thank you.